Welcome to another episode of Holistic Professional Success. My name is Doug Grant, and today we're going to be talking about the big pharma myth and actually this thing that they've tried to create in America as far as its understanding for years that's been blown out of the water. What is it? Let's find out today. Hi everyone, Doug here. Let's talk about big pharma for a minute. Now we're not talking about COVID or any of those things. We're talking about something that's been going on for much, much longer. And it's the myth of what you should be doing to get out of pain. Remember, pain, the number one reason that people go to health professionals is to get out of pain. They have some pain no matter what it is. And one of the biggest things that is out there is that NSAIDs, Nonsteroidal anti-inflammatory drugs, are the way to go. And we've discussed a little bit about this previously, but it's important for us to understand that there are multiple things that the patient that comes to you is looking for. And if you don't provide a holistic answer, you're basically helping with the problem. And so we talk about pain, and if we don't give something to the patients or an alternative or something for them to do, to help them with pain, then they're going to take the NSAIDs. They're going to take the ibuprofens, the Tylenols, and things even more, prescription drugs, to get themselves out of pain. And so no matter what type of holistic health professional you are, we really need to take a look at what we're recommending. And the same holds true for when patients come in and they're overweight. Are we truly hitting the obesity factor? Are we giving them something to do, whether it's a lifestyle change, a simple diet change, to be able to get rid of one of the leading causes of disease today, obesity. And so what I'm trying to explain is that many times holistic health professionals will overlook things because they're worried about being correct, about, I don't want to offend someone because if they're overweight, or I don't want to go down that road of telling people about the damaging effects of NSAIDs because everyone takes them and I don't want to be looked at that way, or I don't want to give them an alternative. I have a lot of clinics that say, yes, ibuprofen and those things and Tylenol are bad for you, but they don't give them something to do, to take in place of. So let's really take a look, professionals, at what it takes to be someone different, to be somebody that stands out so that your clinic really takes off. And one of those things is to address the things that other clinics are not addressing. And one of them being pain. And we know that the myth of NSAIDs has been around forever. Now, in 2016, nonsteroidal anti-inflammatory drugs were the most frequently used group of pharmaceutical compounds in the world, and they still are. And that was based off a report from the NIH. But one of the problems is that the FDA has come out, and you can tell that the FDA has given warning signs for these NSAIDs, that they cause ulcers in the stomach, that they're cause deaths because of the bleeding that comes from them. They're one of the leading causes of death is due to complications that come from NSAID abuse. And so it's absolutely one of the things that we need to focus on. And the research is there. So it's not like we're on some fringe saying, oh, here's what we should be doing. And the other side is saying, oh, that's not true. We have every group, American Medical Association, FDA, all come out and have reported the damaging effects of NSAIDs. And so we have to do something about them. And so it's not something that really should cause a stir. It's just educating the patient about them. So one of the things that I want to talk about today is when it comes to pain and muscle pain, what are the alternatives? And not just with supplements, and we'll talk about that also, but what are the alternatives? And I want to go over some of those things. Research is really strong in some areas to help your patients with pain. And one of the things that's not talked about much is meditation. And so meditation and breathing. So any type of simple yoga, breathing, meditation, there's lots of tapes out there. There's Brain Tap by Dr. Porter, which is a great system a lot of the clinics use. Anything to be able to have the person learn how to control their mind. Because when you go to the doctor and they say, look, tell us your pain threshold from 1 to 10. Well, different people have an ability to handle pain at different levels. And many times it's just the ability to control it. And there's a lot of people that are in pain 24/7. because of low back pain, because of discs that are always causing them a problem, sciatic pain, whatever it might be, headaches. And but they make it just fine because they've been able to control it. So one of the first things is meditation, being able to breathe and meditate to get rid out of pain. What are you recommending with your clinic to the patients in that area? Number one. Number two is food. The more alkaline the foods, the better we can help with pain. Even if the pain is an injury pain, we know that alkaline foods will help get rid of the acidity. They can take a lot of the stress off of the nerves and be able to help. So all of your alkaline foods, let's keep it simple. All of the vegetables are alkaline. And so that's one way to go, is just increase the vegetable intake, and that helps with pain. The third way is to actually replace the NSAIDs and the other anti-inflammatories with natural nutrients. And now all the way back at World War II, they found that proteolytic enzymes, the proteases, the peptidases, help tremendously to reduce inflammation. And there was products like Wobenzyme and some of them that were created out of that. They were great products. It's just that we're light years ahead of being able to work on the potency of using enzymes. So enzymes are extremely anti-inflammatory. The research has been around for years and years and years, way back since the 1940s, and they're very, very effective. So we use a product, Optimal Health Systems, called Optimal Acute, high doses of protease, to be able to reduce that. I just had a lady today that suffers from migraines and is tired of taking all the drugs, saying the only thing that she can take to be able to get rid of the pain, besides drugs, opioids, things like that, is the acute form. And that's just her testimony. But I was interesting that came in just today into the office. And so we know that proteolytic enzymes work, and there are foods that help with that. Your pineapple has a lot of them in it, your papaya. It's just that most of the time there's the enzymes, and they'll help digest that food. You can take the enzymes and be able to get them out, extract them, and put them in the capsule. It makes them very, very potent. And so that's the other factor with it that you can do. So doctors, listen, this isn't a real long podcast today, but the point being is, look at what others aren't doing. They're not addressing the obesity issue and telling people the problems. Just show them the statistics. We don't want to shame anyone. We just want to say, hey, we want to help you improve your health. When it comes to pain, here are answers. What are you doing to meditate? What foods are you eating to become more alkaline to help get rid of the pain? Here are some natural anti-inflammatories that has been around the research for a long, long time with proteolytic enzymes, that we actually now set ourselves apart from the other health professionals, from the other holistic health professionals, because people can come to you and say, look, they're telling their friends, look, this doctor has alternatives. They'll actually put you on a program to help with pain, to be able to help with obesity and not just count calories, that you can do the 21-day blitz or other things just to create some lifestyle change and help people with the microbiome and to be able to change their cravings and reprogram their cravings. So the key today, doctors, is look at what others aren't doing and hit those things head on, but do them in a way of respect and to be able to help people to get out of pain, to be able to help with their issues, and it sets you apart. And as you do that, you'll become legendary in your practice. Let us know what you think. Make sure you subscribe to Holistic Professional Success below, and would like to see what you do in your clinic that sets yourself apart. Have a great day.